Welcome back, Acadiana. We have with us Dr. Tina Stefanski, and you're going to be with us all morning really answering people's questions about coronavirus, because it's such a new virus. And that's the thing. People want to know, like, what should I be worried about? Why should I be worried about this? But it's because it's new.
Absolutely correct. There's a lot we don't know, but learning more every day. So yes, we hope we can answer people's questions and just continue to inform people. And we know the situation is rapidly changing and evolving.
Yeah. And if she doesn't know the answer to your question, she will find out the answer to your question, and we will make sure to get that answered for you. But our first question this morning is: if you've self-quarantined at home, what meds should you take, and would you know if you need to go to the emergency room, especially for people over 60?
Okay, great. So we know from China and now some of these other countries like Italy, who are experiencing large numbers of cases, that people 60 and older, especially 80 and older, are those more likely to be sick or severely ill if they're infected with coronavirus. So if coronavirus is circulating in your community, you may be asked or suggested to quarantine at home, especially if you're 60 and older or have underlying health problems like heart disease, diabetes, liver disease, kidney disease. So if you are quarantining at home, you should have the medications, so your daily medications, over-the-counter medications to decrease fever. So oftentimes with coronavirus, people may have an elevated temperature, which is one of the most common symptoms. So just your daily medications and over-the-counter medications. And then of course, anything else you need, food, just the basics that you need to avoid having to go out and get those supplies.
So how do you know when you need to go to the hospital? Because obviously if you don't have to take up a bed, you don't want to.
Correct. So most people, 80% of people who are infected with coronavirus around the world have very mild symptoms, maybe something like a minor cold. But those 15 to 20% of the people are those people who are older or with underlying health conditions. And it looks like after most of those individuals, after a couple of days, if they are going to become severely ill, it's usually 3, 4, 5 days into the illness, and those symptoms that should prompt someone to seek medical attention always, and we say the same with the flu: shortness of breath, elevated temperature, difficulty breathing, chest pain. If you have any of those symptoms, you definitely need to seek care in an emergency room.
And I think kind of something that we've been hearing a lot is like sometimes the symptoms don't develop until later on, and so unfortunately, you're out in public, you're touching things, people, and all those kinds of things.
Exactly, which is why we see spread, again, across the world when we look at over 100,000 cases now, so in China, Italy, that there does seem to be a case for asymptomatic spread, or when someone has very mild illness, they don't know they're sick, they're not tested, so they're able to spread in the community, especially from one person to another.
All right, so we're going to go into another question. I know we talk about the elderly, but women who are pregnant, their immune systems are already lower because of being pregnant. What are the risks to the unborn baby?
Right, so right now there are no well-established studies in pregnant women against a very new virus, but we do know, again, with something like the flu, pregnant women are at risk for more serious complications. There is no evidence for the flu. There is no evidence that pregnant women are at any greater risk for coronavirus, but we really might not know yet. And so pregnant women do have, their immune system is a little bit compromised in pregnancy. That's a natural state. So I do think it's important when we talk about high-risk conditions that we remember pregnant women, although they're not in the typical high-risk group. They do need to, I think pregnant women should take some, should continue to read and learn about coronavirus. I think we're going to know more over the coming weeks, but right now they're not in the high-risk group.
Because I mean, of course they worry about themselves, but also the baby too.
Exactly, yes, absolutely. Again, not in the high-risk group, but we do need to be concerned that pregnant women, could potentially be, or pregnant women are most certainly at high risk for things like the flu. So we just, again, need to watch the evolution of this virus.
All right, we have